Welcome to the session, Doctoring and Social Media. I'm Dr. Bramstead, your clinical ethicist. This is a compulsory session for all medical students in Year 4 and Year 5. I thought I'd add this slide because I think it's pretty funny. I wish I could see and hear you as you look at this slide. It'd been more funny, of course, if we were all together watching this, but I thought this was very appropriate. I'm sure, as you're all aware, as you're doing your rotations, your iPhone or your smartphone has become indispensable to you in your daily work in the inpatient and the outpatient setting. And we're going to talk a little bit about the pluses and minuses of that, but definitely want to not in any way discourage you to use your smartphone. Want to recognize it as a valuable tool in your practice, but give you some guidance on how it can be used appropriately so you don't go down the wrong path. This is a sampling of some apps that are available just to give you some examples of the way that social media and technology are used in medicine to help you and your patients. For example, the icon you see there in the green called Draw MD, that's something that you could have on your iPad, for example, when you sit down at the bedside and you're going to talk with a patient or their family member about an upcoming surgery, and you want to do some drawing with them, or even allow the patient to do some drawing anatomically. That's a perfect program to do that. WoundSmart is another one that's really helpful. It allows you to visually track the healing of a wound. Okay. MetaMath down there on the bottom, that's another program that contains all sorts of calculations and equations that are pertinent to the practice of medicine. The one there on the bottom left has to do with helping patients track their volume. They often don't know how much they're drinking or not drinking in a day, and this is an app that will let them track that. And that can be very important for patients who have renal or heart issues. You might not be aware that your iPhone can actually be used as a medical device. Up at the top there, the iPhone can actually be converted to an EKG machine. And I have a friend of mine actually that saved a life on an airplane by using his iPhone to take a tracing and then call the results down to an emergency room. And they were able to actually come up with a treatment plan while the patient was in the air because they knew exactly what was happening in terms of heart rhythm. And when they got the patient down on the ground, when the plane landed, they were able to get her the exact treatment that she needed to save, and her life was saved. On the bottom there, you can see an example of using the iPhone as a blood pressure cuff. So basically, in a nutshell, what I'm trying to get you all to understand that we are very accepting of social media as a tool for your medical practice. We think it's a great idea. But you also need to be aware of that flip side, that there's the potential also for negative things to happen. And you can indeed get in trouble with the medical board, patients, your peers, etc. if you don't use social media and your medical tools like your smartphone, your iPad, and all that appropriately. So what we're going to talk to you today about is some guidelines to just keep you on that right path. The article mentioned there on the bottom, patient-targeted Googling, that's an interesting, very nice first place to start. It's in a very good journal, the Harvard Review of Psychiatry. So if you want to check that article out, it's got some fascinating case reports on how doctors have used Google potentially inappropriately with their patients. This was a story that appeared a few years ago in the news on CNN. And you might think, oh, what's the big deal? Doctors having a drink while they're dressed in their scrubs. Well, actually, it is a very big deal. These were doctors who went out to help during a national disaster in a country that really needed their aid. And so, hundreds of doctors got on airplanes and went to go help. And of course, they had some celebrations and got inebriated, and this is what happened. They ended up on Facebook, and it was quite an embarrassment. And you can see there the College of Surgeons says, in any form, the question of drinking beer while wearing surgical gear is bad. And it was obviously a violation of the rules of conduct. So it might seem like a hip thing to do, but it's not an appropriate thing to do. And there's very much a difference between social drinking and inebriation. Okay, and you have to be able to understand the difference between those two things. This is an interesting case to think about. This is Dr. Thran, 48-year-old physician in the United States, working in the ER, and she lost her job because she was talking about her patients on Facebook. The interesting part about this case, and some students don't quite understand, but she didn't get fired because she was mentioning their names, but it was the fact that she was talking about them at all that got her to lose her job. Basically, she was describing their injuries, but that was enough to raise a red flag to the medical board, because sometimes when you talk about people, just even describing them in terms of their diagnosis is enough to identify who a patient is. So this physician lost her job. She got a formal reprimand, which of course goes on the internet for the world to see. She got a financial fine, and then she had to take ethics continuing education courses. Here's another one. A New York medical student took some photos in the anatomy lab and put those up on Facebook. Okay, and then this one here, a Texas medical student was expelled for several years because he wrote a newspaper article about the fact that he had gone on an autopsy, and he described that experience in this newspaper article. Now you may say, oh, well, what's the big deal? This kid was still allowed to graduate, so what's the harm? Well, I would argue there's probably a lot of harm. Think about if you were in year 4 and something happened to you and you had to take 2 or 3 or 4 years off and then come back and try to finish. That would be quite a disruption to your education. Also, the cost of tuition will probably have gone up in that gap period of time, so you'll be experiencing a greater cost to return to school. So there's lots of potential consequences, not to mention the legal fees that the student incurred to defend himself and gain re-entry into school. So it wasn't a simple matter at all. Here's another one. This one involved nurses who were, having fun, quote unquote, doing a food fight while they were on duty at their hospital. And there were a whole bunch of images, actually. I just selected this one that had gone up on Facebook. Well, the problem was there was a patient who had died at that hospital, and that hospital had had some complaints about neglect and patients not getting good care. And when they saw this, a relative, they said, well, here's a perfect example of neglect and not getting good care. The nurses aren't at the bedside, they're goofing around. Is this what our tax money is going for? So this was a pretty big deal. It really says a lot about not only the profession, but it says something too about the corporate image of that hospital. So in a nutshell, what we're asking you to do as medical students and future physicians is to consider the footprint that you're leaving when you're on the internet. Basically, when you're on the internet, your footprint is pretty permanent. It's pretty hard to get rid of something once it hits the internet. It's not like something in the sand which washes away. So you've got to think in those terms that if you put something out there, it's probably going to stick. And so what do you in fact want to put out there? And in terms of social media, it can be just about anything from LinkedIn postings to Facebook to email conversations that you might be having with a patient. Are you having those on a secured email server through your hospital or some other secured encrypted system, or are you trying to converse with your patients on an unencrypted server? All these types of things, this is what you need to be thinking about as a future physician. So social media, it sends a message about you and what your values are. So you've got to ask yourself, what kind of message do you want to send, and who in fact is going to see your messages? Because the audience may be bigger than you think. All right, you may think it's just going to be a few friends or whatever seeing your posting, when in fact word travels, images travel, messages travel, and the audience can be quite bigger than you originally intended. So please be aware of that. And think about how the things that you post could potentially damage your integrity as a person and as a physician. And also, they could hurt the integrity of the institution that you're rotating at or your university. Okay. And finally, remember too that as we've taught you all along in ethics as a medical student and as a physician, the board considers you as quote unquote always on. You can't switch it off. You went into this profession and there were certain things required of you. Okay, you haven't become a real estate agent or a sales clerk. Um, or a property manager, for example. You've chosen medicine, and because you've chosen medicine, there's a much higher standard for you in your behavior and your professionalism. So you've really got to think about that. This is an interesting article that came out in 2011, and it's actually pretty scary when you look at the data that emerged from it. Perfusionists, those are the people who work, for example, in the heart-lung bypass surgeries and operate the equipment that keeps patients alive. They obviously need to be very alert and paying attention. They surveyed these people and found out that 49% of them were actually texting during surgery, 21% looking at their email, 15% surfing the internet, 3% using Facebook or shopping online, things like that. And I think that's pretty scary, because what if that was your friend or family member on the operating table and this was one of those perfusionists that was distracted while they were in the practice of their profession? Okay. Another important area to think about in medicine is medical photography. There are many times in the inpatient and outpatient setting that medical photography is very appropriate. You might see something that is unique, and you might need to document that. You might want to document it for the purpose of a clinical case report for publication. You might be involved in a research study. Something may have gone wrong in terms of a medical error or whatever, and that might need to be documented. But there are ways of going about that. And one of the critical things here is getting consent. All right, and you need to understand the policies and procedures at the facilities that you're working at. What are their procedures for medical photography? You can't just go around snapping pictures with your personal mobile phone and think that that's okay. It's not okay. I've put a link there for you at the bottom of the slide from the journal Clinical Dermatology from 2012. It's a very good paper that will give you guidance about medical photography. But certainly consent is one of the key issues that you need to think about. Misconduct in the social media setting can take many forms. This article in 2009 from JAMA recorded the top types of misconduct by medical students. And profanity was number one. Number two, discriminatory language. And number three, what we talked about earlier, was images or text describing intoxication. All right, so again, with that item, what we're not talking about is social drinking. We're talking about intoxication, which would be professionally inappropriate. All right. Confidentiality violations, these can take many shapes and forms. This is an example from the social media handbook, essentially, of the Australian Medical Association. But this example here talks about somebody doing a rotation in a rural hospital and then making a comment about that in social media, not mentioning the patient's name or anything like that. But what happens is a family member goes on the internet, sees that comment, and is able to historically trace all of your comments and link everything together. And then when they do that, they're able to figure out who you're talking about. That becomes a confidentiality violation. You can, in fact, be held liable financially for patient privacy violations, so you've really got to watch it. Defamation and foul language. This is another thing that clearly would be inappropriate, but defamation, as you remember from your prior sessions in the health law arena, you can be sued for defamation. So you don't want to go anywhere near that because you don't want to be found liable for defamation. So this was an example of somebody being unhappy on their rotation and talking about it and talking about it in a very negative way. It's just not the way to handle it. If you need to vent about your unhappiness, there are appropriate ways to do that, but it's not appropriate to do it in this format when you're defaming someone. Here's another example where an intern thought that she would berate the senior physician about a medical error that that physician made. Again, it's a form of defamation, professionally inappropriate to do in a public arena like the social network space. But it's also really inappropriate to berate someone about a medical error. This physician is probably suffering himself knowing that he did make that error. He's probably dealing with that in many ways, shapes, and forms. And I don't think that he needs or she needs the defamation by an intern on top of it. The Mayo Clinic, one of the world's best hospitals, they really take social media very, very seriously. In fact, you can actually go to the Mayo Clinic and do a residency program in social media. They've come up with a simple 12-word policy to guide their staff to keep on the straight and narrow. Basically, it's don't lie, don't pry, don't cheat. You can't delete, don't steal, and don't reveal. And if you can stick to those 12 key words, those themes should keep you out of trouble in the area of social media. If you'd like more information on the social media policy of the Cleveland Clinic or their special residency program, I've got a link for you there in the bottom of the slide. This is some good guidance here to think about before you post, text, or email. I'm sure we have all, including myself, sent an email or a text or done a post that we regret. If we just would have sat and waited another 5 seconds, 10 seconds, or maybe even waited overnight before we actually pressed send, that would have been a better option. But sometimes we're impulsive, sometimes our emotions take over and we just hit that button and then we're sorry. So before being sorry, take a little break and pause and ask yourself these questions. But basically what you're asking yourself is what I'm going to send out inhospitable to professionalism. Okay, is it a violation of good medical practice, what I'm about to do or what I'm about to say or what I'm about to post? That's what you need to be asking about. Okay, and if you can answer that question in a positive way with good conscience, then that's a good thing. If not, then you need to rethink about what you were going to do. If you need help, the Australian Medical Association put out this booklet a couple years ago, and it's free online. They also have a little video that goes with it. But basically, the most important thing to remember is what they say here on page 9. Quote, medical students are not held to any lesser standards of professionalism than doctors. They may face disciplinary action from their universities, and in Australia, where all med students are registered with the Medical Board of Australia from the Medical Registration Authority. So that's why this is such serious business, and we're trying to give you some protective guidance. These are some more references for you. They both come from the United States, but they contain some really nice examples. So if you have something that's on your mind and you're wondering if this behavior is potentially okay or not okay, these are 2 more sources for you to look at in terms of guidance about social media. Also, if you plan on doing any rotations or internships in the United States, you should be aware of what their feelings are about social media. I want to remind you too that the Faculty of Health Science and Medicine did develop a social media policy in 2012. So you need to know that and be aware of that policy inside and out, as well as Bond University's policy on social media. So know that those exist, search them out, study them. They give you some great guidance on what's appropriate and what's inappropriate in terms of using social media. These are some more documents in terms of the medical school and how your behavior could relate to use of social media, basically conduct and professionalism issues, and what documents are tied to those behaviors. So this just spells out each document and where you can find the information. Thanks for listening to this podcast today. Don't leave yet, though. There's going to be some questions at the end, and you must answer those questions in the post-test successfully, as that is a verification of your attendance. If you have any questions about the topic of social media and doctoring, please search me out, send me an email, or give me a call. Thanks a lot.